Good morning. And if you'd like to continue with your breakfast during our conversation, please do. In most of our countries at 8 a.m., having breakfast while a design or representative speaks is actually quite common. This is the roundtable discussion on innovations in teaching leadership through professionalism. And start with a introduction myself, Sarita Verma. I'm the moderator of this session. I'm also the co-lead of the Canadian Collaborative. And why don't I we'll start. Juanita, are you up yet, or can we just hear you introduce yourself?
Yes, I'm here. I've been here for 15 minutes already and watching all of you arrive. I'm Juanita Besuitnet. In my I'm an anatomical pathologist, but I'm also involved in medical education in our faculty and our country and also on the continent. So it's a bit of a mixed bag.
Well, welcome, and we're delighted that you were able to join us. And we'll start to my right and have them introduce themselves.
Good morning. My name is Marikita Villiers. I'm a family physician by trade, but my job is the Dean of Education at the Faculty of Medicine and Health Science, Stellenbosch University, Cape Town, South Africa.
This is Sanjay Zordpe. I'm the Vice President of Public Health Foundation of India, and my job responsibilities include to provide leadership to the educational initiatives at the foundation across our institutions. I'm also the director of institution which is based in capital of India, New Delhi. It's Indian Institute of Public Health. By training, I am physician, subsequently trained in epidemiology and public health.
Good morning, everyone. Dr. Himanshu Nigandhi. I'm a medical postgraduate by training, and I work with Public Health Foundation of India.
Hi, I'm Maria Tassoni, along with the Canadian Interprofessional Collaborative and the director of the Center at the University of Toronto.
It can't be heard. We're all too tall for the mics. Emmanuel?
Emmanuel Caro. I'm a professor at Université Laval, which is the French part of Canada. I'm a researcher in interprofessionalism field and lead for Université Laval for the CIHLC.
So I note that many of us like to actually quote from great leaders who were leaders during wartime, and I'm not sure if that says anything about the context of what we're dealing with health professions reform, but Churchill said that a pessimist sees the difficulty in every opportunity, but an optimist sees an opportunity in every challenge. So I actually have in front of you optimists who are seeing the opportunity in the challenge before us with health professions reform. I'd like to take the liberty, with the indulgence of my other colleagues from the collaboratives, to also acknowledge Nelson Semenkambo, who's not here today, excuse me, from Makerere University, our Ugandan collaborative. He wasn't able to be here, but I know that you have the progress reports from our collaboratives in the book that you have in front of you, and you'll see that a lot of work is happening across the 4 collaboratives. We're energetic and we're passionate, and we're going forward with the mission to create innovations in health professions education. With the indulgence of my colleagues, I'd also like to ask the Canadian delegation to just stand. We bring our team here, please. We do bring our team here because Canada is a big country, and as a result of actually coming here, we use the opportunity to meet and to do some work. So thanks to our Canadian colleagues from across our multiple institutions in Canada. There were 2 documents that informed our roundtable discussion today. One that many of you have seen, which was the results of the proceedings of the Macy Conference in January in Atlanta, Georgia, Transforming Patient Care, Aligning Interprofessional Education with Clinical Practice Design. And I think actually a lot of the recommendations have already been discussed. I won't go through them in detail, but I'll point out some key words. Engaging patients, families, and communities in the design and implementation of our efforts. Accelerating the design and implementation of innovative models, reforming education and lifelong career development of health professionals, revising, I don't think we got to that one, we talked about revising, but certainly we are tackling the issues of regulatory standards and practices, and also realigning resources to establish and sustain the linkage between interprofessional education and collaborative practice. If you haven't read that document, I think it's actually a seminal document and will inform much of our discussions as we go forward with the forum. The second was actually an article entitled Leadership Competency Models, Why Many Are Failing and How to Make Them Flourish, by Jim Cullen. This resonated with our team, and Patricia actually helped us send it around to folks. Predominantly because the Lancet Commission, one of their major recommendations was enabling the leadership. And the focus of a lot of what our collaboratives are doing, in fact, is looking at innovative ways to drive the leadership. And so many of the characteristics here that we see, particularly the one that's highlighted is around character, resonate with the professionalism and the transdisciplinary professionalism discussions that we've been having. I wanted to just bring some of the context to the global context because we're deeply grateful to the IOM and this forum for inviting our innovations to be at the table. And we hope that by actually putting this in context of what's happening in the rest of the world, this is the WHO chart that many of you will be familiar with, which identifies the world distribution of health workers. The darker circles are, of course, where there's a greater concentration of over 4 health workers per 1,000 population. And the flip of this, of course, is the critical shortage of health service providers. This specifically speaks to doctors, nurses, and midwives, but I don't think that will be quite different from almost all of the professions that we see in the world. And the countries with the critical shortage are in the darker color again, noting that, of course, there is a resurgence of medical schools in Brazil and India and in China, but recognizing that these are probably responding to the need for a global distribution, an appropriate mix, and one that's not necessarily just physician-centric, but actually addresses the needs of society. So our social responsibility is front and center with those 2 slides from our point of view. And in fact, globalization is not something that we can particularly escape. In Toronto, as you probably know, we were immediately hit by globalization by SARS, and how easy it is for bugs not to recognize boundaries. And we're all actually now watching the coronavirus as it traverses from Saudi Arabia to France. And I think notwithstanding the infectious disease part of it, chronic disease is also one that also traverses across boundaries. So globalization, I like the way this describes, is in ways in which nations, businesses, and people are becoming more connected and interdependent across national boundaries through increased economic integration, communication, cultural diffusion, and travel. So I have in front of you a group of people who are looking to the future. And again, I'd like to quote another wartime leader, FDR, but perhaps modify a little bit of what he said, which was, we can not always build the future for our youth, although I think we are trying to build the future for our youth, but we can definitely build our youth for the future. And if we can put the future and our youth in the context of the last panel yesterday, I think we have a urgent need to actually address their concerns that were raised. And why bother with the future? Well, one of my favorite quotes is that if you think you can run an organization in the next 10 years, as you've run it in the past 10 years, you're out of your mind. So healthcare systems are, I think it's actually Cronkite who said, is not only broken, but they're actually in deep doo-doo. So it's my pleasure to introduce the collaboratives of the IHP Global Forum. We're going to start with Juanita Bezuidenhout, I hope I got it right, from the South African Collaborative, with a short overview of what Juanita and her team are accomplishing in South Africa. A very short word from Marieke. Sanjay and Himanshu are going to speak to what's happening in India with the development of their collaborative and actually some of the innovations that are being undertaken. I'm pleased that Maria and Emmanuel will actually speak to our progress. I've asked each of them just to give a 4 to 5 minute overview, and then really to head to the discussion that will inform our deliberations, and hopefully a lot of questions from you as to how we can assist, help, and inform the directions that the forum is going in. So I'm going to hand over to Juanita.